Okay, so what I want to do is show you my system, a simplified way to treat trigger points throughout the body. These are from my courses. I'm going to show you, if someone comes in the lower back pain, how to treat trigger points with lower back pain, so it's simple and easy for you to remember. Why do I say that? Because if you have done any trigger point courses or studied trigger points, you've really got a couple of options, haven't you? So someone comes in with lower back pain, what do? You want to treat the trigger points. How do you remember? Well, you've got one way of remembering, which is to remember all of the muscles involved in the lower back and their referral patterns, right? So, erector spinae, quadratus lumborum, deep and superficial, you've got iliocostalis, you've got multifidus, you've got the deep posterior muscles, and et cetera, et cetera. You've even got the glute medius. How do you remember them and their referral patterns? You don't. You can't. Because, well, maybe you remember the lower back ones, but then someone comes in next week for shoulder pain. So how do you know them? How do you know someone comes in with knee pain, back of the knee pain, right? It's virtually impossible, right? Unless you're really into trigger points and that's your thing, right? So that's one way. The second way is you go to a website or the book and you look up symptomatic lower back pain, right? And then you get this long list of rectus spinae and the points and the referral patterns, iliocostalis, lumborum. You've got all of these and this long list of muscles that you now you can't go to the internet. You know, you've got 6 clients and you can't. Someone comes in with neck pain, someone comes in with lower back pain. How on earth are you going to remember them? You're not, and that's why so many people, unfortunately, remember that 60+% studies have shown 60+% of, or 65 or even 70. I'm not sure exactly the figure, but around about that. Trigger points are involved with joint and muscular pain. So you want to be able to address trigger point therapy, do trigger point therapy and address trigger points. So how do we do this? Right, so here's what I'm going to show you. I'm going to give you a very quick summary to simplify it. And then what I'm going to do is just go a little bit deeper so that you know how to treat your own lower back. So I'll show you that. And then after that, I'm going to show you how you can do a trigger point therapy lower back massage. And I'm going to do a half an hour just to show you, because here's the other problem. Now, the biggest problem, well, those are the biggest problems with trigger point, trying to remember them. And then, as you know, you can't just go and press on these points. Maybe you found the active trigger point and do that, but that's not a massage, is it? Someone's not coming in, even if you fix their pain, you can't just sort of press here, press here, press here, do trigger point therapy. Even if they feel better, they still want a massage, right? So, this is what I've done. I've made it simple to remember, simple to apply, and still being able to give that person an incredible massage experience. Because if you're a massage therapist, whether you fix their pain or not, they still want a massage, right? So here you go. Here is how easy it is to address lower back pain with the with the 4 muscles, right? The deep posterior muscle, right? Number 1, deep posterior. So don't have to worry about names. There are several deep posterior. All you need to remember with deep posterior is they're going to be, the trigger points, if they're active, will be where the pain is. So someone comes in with pain in that spot, you're going to press around about that. If it's really, really sensitive, that's potentially the posterior deep. So in other words, press where it hurts. Simple as that, right? Now, then we've got the erector spinae. So erector spinae up by the iliocostalis, just under the rib. I'll go into this in more detail, but just under the rib there, right? So you go up under that 12th rib there, right in the iliocostalis. I'll show you how to do this. I'll show you on the... So that can refer pain to the lower back as well. Right, so that's those, okay? So deep posterior, where it hurts, right? Then we go up under the ribs there, and we've got the iliocostalis there, part of the erector spinae group. So you just go up there. Quadratus lumborum, right in the same area, under the ribs there, okay? All in that area. So you've got this area. Doesn't matter whether it's ilio... Who's going to know? You're not going to know your palpation skills. Right? Unless someone's really good that they can go through erector spinae or around to quadratus lumborum and deep to that. No. And it doesn't matter at the end of the day, where if you just got to find and go, oh, that's really tall and that's radiating. Well, we got it, right? Doesn't matter what muscle it is. So those points are exactly around the same area. So that's that. And then all you've got to remember after that is the glute medius around here, which I'm going to show you, on top of the hip, top of the ilium there, all right? And you feel for tendons, which I'm just about to show you. That is it. That is the vast majority. If you're going to treat lower back pain, that is the vast majority. That's it, right? Deep posterior, where it hurts. And then just up under the ribs, which is your iliocostalis and quadratus lumborum, and out on the tops of the iliums, the quadratus, beg your pardon, the glute medius. Okay? Now, I'm just going to show you how to treat these on yourself. It's just going to clarify everything for you. But you see how simple that was? You do not need that huge amount of muscles, which is confusing. You'll never remember them anyway. So, I'll show you, and this is my method. If you want to have a look later on after you have a look at this, I've got bundles on these. I've got 3 different courses and cupping for trigger point therapy as well. In the resources below, I've got discounted bundles, but let's have a look. Okay, so what we want to do now, we will have a look at the deep posterior back muscles. So these are little muscles. They're short, they're multifidus, rotatories, these types of posterior muscles that are deep. So you've got the erector spinae, either side of the spine. These ones are deep, keeping the vertebrae in good position or trying to. So these muscles, if a person's got pain, it's generally centralized. So that trigger point will be just slightly lateral, okay? And it's generally in the groove or slightly out underneath the erector spinae muscles. So what you want to do on those vertebrae, let's say someone's got pain right at the base of the spine, okay? It's like really central. Start thinking those deep posterior muscles. So let's say it's right at the base of the spine. Just come out slightly, start working, and I'll show you later on. But so you want to start working with the, say if it's for yourself, with the ball, and you're going to go into the groove between the spine and the erector spinae muscles. So you've got the spine, and then there's the groove, and you want to work there, and about to an inch and a half out underneath the erector spinae muscles as well. They travel out that far. So just remember where they are, the trigger points, the pain will be central, right, just right across from them. So they're really easy. It's a very central pain pattern. And these can cause sharp pain. They say posture affects these muscles because these poor little muscles are trying to keep you in good posture. And of course, what happens with bad posture is they're contracting. So think about it. If this is you, your clients, making sure that you teach them to have good posture, because the only time these are relaxed, these muscles, are when you're standing straight or laying down, okay? So once again, start thinking, if it's for yourself, if you're tight across these shoulders, that's pulling your head forward, you're sitting like this. As I teach my clients, and have done for years and years, sit tall, stand tall, walk tall. Feel like you're getting elongated by balloons. Remember what I said to you, when you're not in good posture, these multifidus are contracting, having to hold you back. And of course, this tires them out, sets you up for more trigger points and more pain. So just remember that. Remember teaching your clients, okay? So how do you treat these? Right, so the tennis ball, once you want to go into that groove, you want a smaller ball. This might even be a little bit too big, maybe a smaller, one of those little rubber balls, but you can still do it. So get on there, up against the wall, and start pressing against, working your lateral to where those painful, and start feeling those painful areas, holding there, pressing against there. You can use if you've got one of these back knobbers, absolutely start working there. So off the spine, just slightly lateral in the groove. You want to start working there. See what feels good. Does it feel good to go up and down it? Maybe across, not across the spine, not flicking the muscle, but you can do very minute movements. Just see what feels better. One might feel more releasing, and then you just kind of work your way out. So remember, where the pain is, you're just going out laterally. So it's a really easy one to find because the referral pattern is just central to where the trigger points are. Okay, so what we're going to do now is look at the erector spinae group, the big back muscles that you've got going either side of the spine. Now, they consist of 3 different muscle groups, longissimus, iliocostalis, and spinalis. Don't need to remember them, doesn't matter. Some people call it the backstrap muscles, the big muscles either side of the spine. Now, the trigger points, so the posterior deep muscles, as I said, it tends to be really central, right where the trigger points are. They're really where that pain is, where the trigger points. The one we want to look at, there are 6 trigger points in the erector spinae, but the 2 of them are higher up. Don't need to remember them. We're just going to look at the ones that create lower back pain. And these are right at, so we've got these 2 points here that can refer right down into the buttock, and they're very, very commonly affecting with lower back pain. So how do you find them? Well, I'll give you a better look at this when I'm treating on the table, but it's at the T12 where that bottom rib is here. So I'll turn around and I'll show you. Okay, so if you come down here and it's slightly lateral, so here's my spine, okay, there's that groove next to the spine that we talked about where the deep muscles are, the deep back muscles, multifidus, rotatorius, semispinalis, these sorts of muscles in here, and they come out further out to here. Now we're coming out right out here, okay, just off those, so just out further is where you find that trigger point. And there's that bottom rib. So again, I'll show you, it'll be better to find it, but that's where you want to be, out here, and I'll show you as I say. And that is going to be where we're going to find the quadratus lumborum deep to those. So I'm going to show you how to get to those, but they're basically the same area. So right at where those bottom ribs, if you know your anatomy, T12, L1, around about that area. So what you do, you want to get onto those, and again, you got lower back pain, you really want to be starting to think working those up there. Don't forget about those. And again, I'll show you in more detail when I'm treating someone on the table. Okay, so let's have a look at the quadratus lumborum, otherwise known as the QL, and that's what we'll call it, the QL. Right, so just to go back, those deep muscles in the spine will radiate pain right where the trigger point is, or maybe slightly central, okay? So in other words, pretty much where that pain is, where we're going to find those deep posterior trigger points. Okay, now the other one, as I said to you before, the one in the superficial, that can radiate down, all the way down to the buttock, and it's just, as I said to you before, it's at that lower rib as you're pressing in. So we're right at the edge of the muscle. So if you track your, just so you remember, so if you track across, so obviously you're not off the muscle, you've got to come into the side, and we're right in there, okay? So you're at the side of the muscle. Now the quadratus lumborum, right, this can cause lots of pain, does cause lots of pain. It causes lower back pain in the quadratus lumborum muscle itself, and there are generally two, right now, remember the iliocostalis that we talked about, the superficial, right, well these are in the same spot where those lower ribs and the spine, you kind of get into that corner there, but the difference is, if you come right from the, I'll get my little knobbler here, so if you were to come, okay there, you're going to get the superficial back muscles, right? Because these muscles are deep to them, so we have to come round to the side. So you kind of come round this muscle and then dig into the side to get to these, okay? There are two at the top, so directly beneath the iliocostalis, but we've got to come around to the front more, so side front area to get to them, okay? And they'll feel like bruises, they're really sensitive. So we've got a couple up here, as I said, they can produce pain in the like lower back muscles, but also into the hip, outside hip right up to the top, the iliac crest here, and even into the buttocks there. So you can see the four referral patterns on the buttocks. Outside hip, higher up on the hip. So if you look at the trigger points, the ones most likely to be the lateral pain radiating are those lateral trigger points, okay? And so you come into there, so that's more likely to be and you'll see this all the time, right? That the trigger points, again, this is good news because you're not having to go to the piriformis muscle right over by the sacrum if there's radiating pain, because it doesn't radiate, it's the other trigger point, right? So we're simplifying it again. And I hope I'm simplifying this for you, but it'll all become clear, so don't worry. So all I'm trying to say is those higher ones are going to be more likely to produce pain higher up in the buttock. The more lateral ones are going to be more, maybe higher up and more lateral, okay? So that is your quadratus lumborum. So there we are. Now gluteus medius, this one you really need to remember because it's a very common cause of lower back pain. So this is lower back pain across. Now by the way, we're talking about lots of hip pain, buttock pain. The vast majority of your clients will come with just lower back pain, not going into the buttocks and hips, just so you know, okay? Which is good news because it makes it simplified more as well, because we're still going to do the same things, okay? Right, gluteus medius, so just remember those trigger points. So to find these trigger points in your glute medius, you can stand on one leg and put your hand, so here's my hands on my hips on the ilium, just come down, so you've got your greater trochanter, your hip bone here, it's between that and the top of your hip, so your ilium. Press down, you can do it sitting down, press down and you'll feel that muscle contract immediately. There's your glute medius. And if you work across them, you'll feel very sensitive spots, okay? So of course, if you've got your tennis ball or your knobbler, you can go up against the side of a wall here and just work all the way around, right around right back almost to the sacrum. And you'll continue to feel these right there, really sensitive spots. Okay, so I hope you enjoyed the video. So I didn't lie, did I? I have managed to simplify it for you for when you treat someone. Now, there are a couple of other muscles, but they're like, you know, say, the old saying is, when you hear hooves, clippity-clop, coming down the street, think horse, not zebra. In other words, these are the lowest hanging fruit, the most common ones that you're going to see involved. Okay, so you know how to treat yourself, you know how to treat. Now, what I'm going to do now in the next video is show you how to do a beautiful 30-minute deep tissue massage that works through the lower back and the top of the buttocks there to get the glute medius like we just talked about, and have it a beautiful treatment, and also is going to help people with lower back pain. So if you like this video, don't forget to subscribe, like, you can comment below, and also your resources. I've got fantastic deals with bundles of my online courses, whether it's aromatherapy, whether it's massage. You can have a look at that, and if you're interested, you can go along, click the links, and see if that's something you'd like to do.